Well, like I was saying, you want to rub your hands real good together like singing the happy birthday song. And in my research, trying to get this project together, I did a research that came out of a nursing journal where they did a study where they were trying to see if more germs were being passed with the equipment, and the germ what was being passed was MRSA, methicillin-resistant staph aureus, or however you say that name, but it's MRSA. And what they was noticing that you know, insufficient cleaning of the poles and the actual machines that was being used, that's how they was contracting more and more MRSA. So they had a study where, you know, they made sure everybody was wiping everything down. You made sure that, you know, the machines were very, very clean between patients. And in that study, they noticed that, you know, the numbers came down significantly after the study was, and you know, they was watching everything and they could keep an eye on everything, and they could tell, you know, if the machine was being cleaned on time, in between patients and all that. So that was a pretty good study. And they found out, you know, that with proper hand hygiene, all this led back to hand hygiene, and that is why proper hand hygiene is very, very important, because you can be spreading something as serious as MRSA, and MRSA is serious. So we want to practice good, proper hand hygiene at all times. So I've heard people say, you know, as long as, you know, I'm wearing gloves or whatever, you know, in between patients, you know, the hand washing is not very necessary. Well, the hand washing is very necessary, because just because you're wearing gloves does not mean that you're not picking up something along the way. Gloves are not that protective. They are protective, but they're for a reason. They're not to take the place of washing your hands with soap and water. So right here, I just have this little thing that I found was cute on the internet. And it's just a 5 steps for proper hand washing. And I just want everybody to get a chance to look at it and let me know your thoughts or whatever. Yes, the first part is in Spanish or something, but I liked it because of the little boy and the way he was really trying to get his hands clean. So it lets us know, you know, we want to wet our hands with water. And then we want to apply the soap and rub for at least 20 to 30 seconds. We want to get our palms real good. We want to get even our wrists. Some people think, you know, they can go in there and just, and they're down hand wash. You have to actually get your wrists and all. You want to do the back of your hands. You know, some people, I have seen some people just run their hands under the water. You know, this part don't even hardly be wet. You have to wet your whole entire hand for your hands to be clean. You want to get between your fingers. You want your fingertips to be clean when you're hand washing. Your thumbs. You want the backs of your fingers to be clean. All of this needs to be included in your proper hand hygiene, because if it's not, you've really not successfully performed proper hand hygiene. So, just like my poster demonstrates, you know, we want to soap up really, really well. And we want to just scrub. You know, you want to get the germs off of you, because you don't want to be spreading something like MRSA. MRSA is serious. So on our pop test, we had some questions on here. And one of the questions that I really wanted to make sure I put on here, because I hear so many different stories, was that you should only wash your hands at work if you touch a patient. That is false. You should be washing your hands all the time at work, because I'm a nurse right now, LPN, and I mean, it's just become a habit that, I mean, I wash my hands literally the whole shift. I mean, your hands just feel, when you're working with patients and stuff like that, I work in long-term care, it's just a habit for me. I don't know about nobody else, but you need to be washing your hands a lot while you're at work and anywhere else. So what I'm going to do now is see if there's any questions or comments. Anybody want to share a story, perhaps, about hand hygiene or anything? Like I said, I used the nursing journal, and my article was really good. It shed some light, you know, it really wanted me to make sure, you know, because in the nursing field or any professional field, like in healthcare, you kind of get, you know, relaxed, and, you know, sometimes you might not be showing the kind of time that you need to things such like those poles and those machines. So you really want to be careful with that, you know, and it really did spark some concern to me to want to do better as well. So what I'm going to do now is I have a little pop test, since my video is coming to an end, that I want to share for everybody to fill out. And then you can let me know if you have questions or concerns. And I will fill out one with y'all. So, do anybody have any questions or concerns about the pop test? Okay, and I'm pretty sure that everybody did well. And now we will just go over the pop test a little bit. And we wanted to make sure that everyone understood that number one was all of the above, because healthcare workers are exposed to germs on their hands by doing the following. They can be exposed by pulling up patients in the bed, yes. Taking a blood pressure or pulse, yes. Touching a patient's hand, yes. Touching equipment like bedside rails, over bed tables, and IV pumps. All of those predispose you to getting germs on your hands. So if you're in a situation where any of this is involved, you need to be washing your hands. How long should you scrub your fingers together when washing with soap and water? We picked the 15 seconds. Did anybody else pick anything different? Okay, well, that is the correct answer, because like the poster says in my little handout, it is recommended that you rub your hands together for at least 15 to 20 seconds. Just a clean, good scrub is what you need. A clean, good scrub. And we had one question that said, when would you wash your hands with soap and water? So we had some choices of your hands are visibly dirty. Yes. Hands are visibly contaminated with blood or body fluids. Of course. After using the restroom. Yes. And between patients. Yes. So all of the above was the answer. Did anybody get anything different? Okay, that is the correct answer. And I think everybody did really well on their pre-test and pop test. And I hope you have enjoyed this teaching project. And this concludes my teaching project on practicing good hand hygiene, where we had our poster as our visual aid, our sheets, and a pre and pop test with our age ranges between 21 and 41. Thank you.